Welcome back, and of course we are live on X Spaces, on Facebook, on YouTube, and of course on myjoyonline.com. This is the pulse right here on Joy News. Now, from railway workers who have not been paid for 7 months, let's move to another sector. They've also not been paid the allowances, and they are not happy. The Rotational Nurses and Midwives Association of Ghana is threatening to withdraw all services if government fails to disburse their delayed allowances within a week. Now, at the news conference held this morning, the association's national president, Ebenezer Boatem, described the situation as dire, citing worsening living conditions and tragic consequences of the prolonged delay.
As members of the 2024-2025 service year group, we have been diligently working since May 2024, almost a full year, without receiving financial clearance, thereby depriving us of our rightful allowances. This repeated delays reflects a systematic neglect that has persisted over 4 years, with little to no meaningful intervention from the Ministry of Health. In April 2024, Honorable George Opariado, now Minister for Youth Development and Empowerment, condemned these delays in public statements, giving us hope for change. Unfortunately, since the change in administration, all efforts to engage the relevant ministries and authorities have been unsuccessful. This prolonged financial neglect has had dark consequences. During this period, 5 of our colleagues have tragically passed away, and 6 others have been diagnosed with serious chronic illnesses requiring urgent medical care. Should our concerns remain unresolved, we will be compelled to withdraw our services nationwide until further notice. While we lack the financial strength to stage public demonstrations, we will not work under such dehumanizing conditions. We will only return to duty when our rightful demands are met. Our senior colleagues have been going through this dehumanizing condition for years. You would have to complete your 1-year mandatory rotation before you receive your allowance. It will take about 4 to 5 months before you receive the allowance. As I speak with you this morning, our senior colleagues who completed for us to also come in, which is the 2023-2024 service year group, some are yet to receive their allowances. Life has been unbearable for us. Very unbearable. Now, we have to venture into other enterprises and other means to survive. Now, what saddens me is what my colleague ladies have to do to survive.
So let's get to understand the issue much better. Now, joining me in the studio is the president of the Rotational Nurses and Midwives Association of Ghana, Ebenezer Boatem. Mr. Boatem, you're welcome.
Thank you, sir.
So first, educators, who is a rotational nurse or midwife?
Okay, thank you for the opportunity. I would say a big thank you to you and your crew. Also to my colleagues. I believe they are watching, and I wish they send in their comments. Rotational Nurses and Midwives Association is an affiliate of Ghana Registered Nurses and Midwives Association, RNMA. And we comprise of general nurses, midwives, mental health nurses, and public health nurses who have successfully passed their NMC licensing examination.
Right.
And are currently undertaking their 1-year mandatory national service. Because we roam all the wards. They call us rotation nurses because we roam all the wards before we complete, so that we will have experiences from all the wards, such that when you are posted, you wouldn't find yourself wanting.
Right. Yes. So, therefore, you are not officially employed yet?
We are not employed.
You are you are doing national service, if you like?
Yes, please.
If for doctor, it will mean housemanship?
Yes, please.
And so what you talk of is allowances that should keep you going, and that has not been paid.
Yes, please.
How much are we talking about?
We are talking about 815 cedis a month.
815 cedis a month?
Yes. Currently, the living conditions in the country, it is nothing to write home about. But at least, if it were coming on monthly basis, it would have helped in a way or two. And this is what we are crying for. We started our rotation in May 2024, and we are in May 2025. And we don't even have financial clearance yet. So if even the clearance is in, and your name is not part, it means you've served for a year, and you don't even have financial clearance, and you are not receiving anything.
So basically, find out if so 1 year, meaning you should actually be finishing this service.
Yes, please.
This phase of
work.
work.
We will complete on May 22nd, because we started in 22nd May 2024. So 22nd May 2025, we are supposed to complete our national service.
And no word as to when this money will be paid?
No word. No word from anyone. Even taking into consideration the effort we've put in place to reach out to our stakeholders, to even hear from them. No word from anyone.
And how many are you in terms of your nationwide number?
Okay. So currently we have the 2024-2025 service year group, the cohorts. I am a member of the 2024-2025 cohorts. And we are over 20,000 in number. And then we have the 2025-2026 cohort. They were just posted, and they are around 17,000. So approximately together, we are close to 40,000 in number.
And every one of you is yet to be paid this,
Yes.
this 815 cedis a month. That is now accumulated to a year.
Yes, please. I will only take out our colleagues who are degree nurses. For them, the allowances come from the National Service Authority. So they are not owing them. But for those who went to the training colleges with diploma, we have not received anything from them. And we are the greatest number. Our colleagues from the universities will not even be more than 5,000.
All right. And you say that this is impacting negatively on your members.
True.
And you are linking 5 deaths to this current situation.
Yes, please.
How?
Okay, so this is it. Assuming a member is suffering from a chronic illness and needs money to sort things out or to pay for medical bills and other things, should this money be coming, at least they could have used it to buy medicine or any other thing. Now, about 2 years ago, one of our colleagues in Sunyani had to hang himself because he was owing all around him. He was owing people. And day in, day out, they were coming to him for their monies. And out of that shame, he hanged himself. He wrote a note in that regard.
Indicating the reason why he took his own life.
Yes. And these are clear examples of how unbearable things are for us. And we want Ghanaians to put themselves in our shoes. Assuming if we work for, let's take only 2 months, and you've not received anything. See, some of us, apart from the fact that we are having a national service, we have families to take care of.
Right.
So it makes things very unbearable for us. And it's very true.
And any reach out from government, for example, the Ministry of Health?
Yes, about 3 weeks ago, we brought out a press statement and we granted interviews on some media stations. So I received a call from one man who said he is the spokesperson to the minister.
Minister for Health?
Yes, please. He wanted to speak with me on phone, but I opted for
a face-to-face conversation.
Interaction, yes. So I went to his office. Luckily enough for me, the PRO for the ministry was also there with 2 other people, big men from the ministry. They were there. So I went to meet them. And after everything, we were to schedule a date to meet them for a clear pathway or a way to end this problem. But we declined their invitation on the fact that last year, in April last year, our predecessors organized a demonstration. So when they got to the Ministry of Health, the PRO to the ministry met them, told them to hold on with whatever they are doing because they will schedule a meeting with them and find a lasting solution to the problem. So they scheduled this meeting, gave them all the assurances in the world. Right after the meeting, my former president gave me physical evidence of the calls and the WhatsApp and text messages he sent to the PRO without a reply. They didn't hear anything from him until August, September, where they started receiving their allowances. So based on that, once bitten, twice shy, we will not also come and have this meeting with you. You give us assurances.
But it is this conversation that can get this matter resolved. And if you are not availing yourself to the ministry, then you will continue to shout in the media.
Yes, we told them that we would like to honor their invitation, but the minister should be present in that meeting. If the minister wouldn't be there and the chief director, fine. But to meet the PR and the spokesperson alone, we perceive that it will end up as it ended up last year. Because it's their responsibility to calm us down and they calm nerves down. That's their responsibility. But we need the minister to know what we are going through, although he knows. But officially, he may say he doesn't know. So we want to meet him officially. We find a lasting solution to this, then we can resume whatever we...
And you say that if this is not done in a week, you will pull out from the walls.
Okay.
How would that affect service delivery in the hospitals?
Thank you so much. I like this question. As we speak, when you go to any facility in the country, you wouldn't be able to distinguish between a service personnel and a staff because we do almost the same thing. There has been countless times that I personally have been the only person at the ward taking care of clients. When you come, you wouldn't know that I'm a service personnel because I have the skill and the knowledge to perform.
Right.
So now, we are crying out to the ministries, we are crying out to Guineans, we are crying out to the government to come in and find a lasting solution to this problem. Should they ignore us? We gave them 14 working days. 14 working days.
2 weeks.
Yes, to give us our financial clearance. Then afterwards, we give them another 14 working days to pay our allowances to us so that we will resume work. We are not leaving. It's not only the 2024-2025 cohort that will be on strike, but our junior colleagues that were posted not long ago will also join us because they also need their financial clearance. Else, they will end up like what we are also going through. So we leaving the wards, our staff will tell you, will be a very big problem to the health sector because we perform almost, should I say, 30 to 40% of the responsibilities of the staff. And should you take us out, I think they can testify what they go through.
All right, we'll leave it here for now. We hope that the ministry will call on you for a dialogue on this matter. Ebenezer Boati, thank you so much for coming through.
Thank you too for the opportunity.
All right, let's take a short break here on the pulse and return with more.